Vaginal secretions or discharge other than your period as part of your natural menstrual cycle. It's normal to produce clear or white secretions discharge from your vagina. This mucus is produced naturally from the neck of the womb, known as the cervix. Vaginal discharge is not always a bad sign, says Dr. Neil. There is a myth that copious clear or white discharge is associated with sexually transmitted infections. Changes in the amount of discharge can be 100% hormonal, in other words, linked to the menstrual cycle, pregnancy, or menopause. The character and amount of vaginal discharge varies throughout your menstrual cycle. Around the time your ovary releases an egg ovulation, your discharge usually becomes thicker and stretchy, like raw egg white. Healthy discharge doesn't have a strong smell or color. You may feel an uncomfortable wetness, but you shouldn't have any itching or soreness around your vagina. If there are any changes to your discharge that aren't normal for you, such as a change bacteria in the vagina, there are lots of bacteria inside the vagina, and they are there to protect it. Professor Ronnie Lamont, spokesperson for the Royal College of Obstetricians and Gynecologists, says, "The vagina contains more bacteria than anywhere else in the body after the bowel, but the bacteria are there for a reason. The good bacteria inside the vagina provide numerical dominance. They outnumber other potential harmful bacteria that might enter the vagina, help keep the vagina's pH balance. How acidic the vagina is at an even level, which helps keep the balance of bacteria healthy, can produce bacteriocins, naturally occurring antibiotics, to reduce or kill other bacteria entering the vagina. Produce a substance that stops invading bacteria sticking to the vagina walls, which prevents bacteria invading the tissues. If the balance of bacteria is disturbed, this can lead to infection and inflammation. Bacteria called lactobacilli help keep the vagina's pH balance at its normal low level, less than pH 4.5, which also prevents the growth of other organisms. If the pH of the vagina increases, it gets less acidic. The quality or amount of lactobacilli can fall and other bacteria can multiply. This can result in infections such as bacteria. Washing your vagina. It's a good idea to avoid perfumed soaps, gels, and antiseptics, as these can affect the healthy balance of bacteria and pH levels in the vagina and cause irritation. Use plain, unperfumed soaps to wash the area around the vagina, the vulva, gently every day. The vagina will clean itself inside your body with natural vaginal secretions discharge. During your period, washing more than once a day may be helpful, says Dr. Neil, who points out that keeping the perineal area between the vagina and anus clean is important, too. Good perineal hygiene is necessary by washing that area at least once a day using your normal bathing routines. All women are different, says Professor Lamont. Some may wash with perfume soap and not notice any problems. But if a woman has vulval irritation or symptoms, one of the first vaginal douche is a douche flushes water up into the vagina, clearing out vaginal secretions. Some women use a douche to clean the vagina, but using a douche can disrupt the normal vaginal bacteria, so it isn't recommended that you use one. I can't think of any circumstances where douches are helpful, because all they do is wash out everything that's in the vagina, including all the healthy bacteria, explains Professor Lamont. There is no evidence douching protects against stis or vaginal and scented wipes and vaginal deodorants. These perfumed products can disrupt the vagina's healthy natural balance. If nature had intended the vagina to smell like roses or lavender, it would have made the vagina smell like roses or lavender, says Professor Lamont. Washing with water and a plain soap should be all you need to keep your vagina healthy. It's normal for the vagina to have a scent. Vaginal odor can change at different times of the reproductive cycle and shouldn't always be thought of as being a sign of infection or illness, says Dr. Ilneal. If you're worried about the way your vagina smells, the smell isn't pleasant, or you're using perfumed products to cover up your vagina smell, you should see your GP. You might have an infection that needs treatment. The most common cause of unusual vaginal discharge is bacterial vaginosis, which can cause an unpleasant smell.